afternoon, everybody. I'm Dr. Cosentino. We're going to talk this afternoon about mesotherapy for the face, specifically mesotherapy for underneath the chin. Now, I know we talked about that a little bit this morning. I just want to kind of go over this a little bit, make sure that everybody understands this, because this, by far, I think is the easiest, fastest, probably the most popular use that you're going to get with mesotherapy. So what we talked about so far is that, before and after results are pretty impressive. All right, and you can see some pictures here of that. This is not, you're not going to be injecting a lot. That's important because a lot of times people, when they inject, they over-inject and they use a little bit too much solution. Does anybody remember from a few minutes ago what the dosage is and what specifically is the medicine that we're going to use? PCDC. Okay, right. So it's straight PCDC. You don't have to mix it with anything else. If you want to put a little bit of lidocaine in there, obviously, that's not a problem. The dosage is 0.8 cc's. So you're taking a tuberculin syringe and you're filling it up 0.8 cc's. Now, if you want, you can put 0.2 of lidocaine in there as well. Okay, but you're not mixing anything else. You're not using carnitine or L-carnitine or amylophenol or anything else. It's straight PCDC, 50 milligrams of the PC and 42 milligrams of the deoxycholine. All right, so the technique is there's a couple different ways you can do this. Okay, some people, and you'll see from the slides, they'll just inject directly into the fat. So they'll take one injection, one needle, and they'll go right straight into the fat. Okay, and they inject the entire amount, the 0.8. What I like to do is I like to take that 0.8 or 0.9 so that it's an even split, and I'll inject 1/3 over here, 1/3 in the center, and then 1/3 on the other side. So you're basically getting the whole, lower part of the chin with an equal distribution of medicine. Okay, so 1/3, 1/3, 1/3, 0.3, 0.3, 0.3. All right, and that's really about it. Your technique, obviously you're following sterile technique and all that sort of stuff. We're not going over that because we know that already and that applies. What about the frequency? What is the frequency? Surprisingly, you're going to see a lot of patients coming in with very, very good results after just one treatment. Okay, that may not be the typical case, but a lot of patients will come in, 10 days later, and you will need to do a second treatment. All right, so kind of keep that in mind. You can do up to 3 treatments, and it's spaced out between 3 and 4 weeks apart. So you see them today, you have them come back 3 to 4 weeks later for their second treatment. If they need a third treatment, then you have them come back again 3 to 4 weeks. So it's up to 3 treatments, and other than that, that's really about it. It's pretty. I think it's pretty straightforward. Any questions on how to do mesotherapy for the chin? Anything? No real male versus female differences. It's pretty much the same. Just make sure. I think it's important, and I see this a lot actually during the hands-on part. We're doing patients that have fat underneath the chin. So if you see somebody, and I think I have a couple examples of this, that you're looking at loose skin, like this is a very good before and after. This obviously is a very good before and after. Yeah, this is another pretty consistent example here. All right, but what you're not doing is you're not doing somebody that just has loose skin, because it's not going to do anything at all, and in fact, it could make it a little bit worse.